Uh, I hope I am audible. Okay, so I think we have a few participants here. So let's just start as we have, 2 3 minutes have already passed. So welcome all of you to this session on the communication station. We will be generally in the start, we'll be generally discussing about communication, how it goes, and specifically breaking bad news. And after that, initially I'll be telling you some important points. And later on, we will have a scenario, and any one of you who is interested can volunteer for that. And if hopefully we'll get a volunteer, but in case we don't, then we'll see that how we have to proceed. So let me introduce myself. I'm Dr. Iqra Ahmed, current registrar in pediatrics. I have passed my MRCPCH 1 year back from Pakistan center. And since then, I have been involved in teaching candidates. Recently, a few of our candidates have passed from the UK center, and we are hoping to have more good results from the other centers as well. Um, so let's start with the communication station. I know some of you might already know a lot of details about how a communication scenario goes, what are the prerequisites, what are the initial details, but I believe that there are always some candidates who have just started preparation. They do not have a lot of information about the station, how it goes. So we'll be just taking it since this is a preliminary and a starting basic information session. So we'll be taking it from the very beginning and from the very scratch. So communication station and the clinical exam, you have two communication station, 9 minutes each, and each station has 8 marks. So communication is one of, I would say, the most maybe difficult stations because there's a lot of variety, there's a lot of practice that goes into preparing for the station. So the candidates who start preparing for the exam, this is like one of the initial stations that they start practicing with, and this its practice keeps on going till the end. Because in the other stations, like the clinical station, you do have some practice on the real patients. In the video station, that's an easy one as well. But the communication can be very unpredictable because the scenarios are of multiple kinds. You do not know how the role player goes on and how do you have to go through the station. So it needs a lot of practice and a lot of knowledge. So let's just start with the breakdown of how the communication, this is the communication station flow chart. So what happens is that when you are sitting outside, you get 4 minutes, and in the 4 minutes the candidates, they read the candidate information sheet. You are given a sheet outside, and that is like a laminated sheet which has a proper question on it, a proper detailed scenario on it. Along with that, you do have a paper and a pencil in your hand, and you can write down a few things. And in those 4 minutes, we are going to discuss that what we have to do in those 4 minutes that are outside. After that, the bell rings and you go inside the station. The examiner introduces himself and the role player. Then the examiner provides the introductory statement very briefly because you have already read the whole scenario outside and prepared yourself. And then examiner asks the candidate to just begin the station. So the setting is like that. There are two chairs, and usually there's a table in between, and there's a certain space between the two chairs. So you sit on one chair, and across the table, you have the role player. The role player are usually actors, and they are very well prepared, and they are very, uh, they have a very good practice of the station. So they know how do they have to act, how do they have to react to any situation. So they're like more of a real patient. In fact, like better than the real ones. So on the table, you can have a water bottle or at times a tissue, because in the cases where you can expect that the parent or the role player can cry or can get a bit emotional. So you might offer them those things. So you just sit there and you talk to the role player, and then whole 9 minutes goes on like this. The examiner sits on one side and he is just going to observe you throughout the station. There is no interaction with the examiner. The examiner is not going to stop you at any point. He's not going to he's not going to guide you in any of the things. He's not going to probe you for anything or compliment you for anything. So the examiner is just sitting at the side and you are just talking with the role player, and the whole 9 minutes goes on like this. So after the 6 minutes, there's a bell or a warning signs that the 3 minutes are left, just to tell you that you have to start wrapping up your scenario and go towards the conclusion. At 9 minutes, when the station is over, you just get up, you go out to the next station. So there's no active involvement of the examiner in the station. He is just marking you depending upon the performance that you have done. So, what to do outside the station? The most important thing to do outside the station is to read the paper carefully. So, one of the mistakes or one of the usual practice when the candidates are practicing with each other is that they give very small scenarios to one another, and which like does not need a lot of information to process. Contrary to this, when you are in a real exam and you have a proper like the proper question sheet, it has a good long scenario in which the first thing that is given is the setting. So you have to see what the setting is. It can be an outpatient, an emergency, depending upon what the scenario is. After that, your role player, which is usually a pediatric registrar, your location, like where are you sitting and all that. So you have to just read through that. And then there's a whole summary that has been given in which the whole scenario is being told in the detail. So it tells you about all the information. It can be, you have to read it very, very carefully. You have to write down the name and age of the child and name of the parent as well. Okay, the role player, that's really important. Why? Because at times in hurry of just reading the scenario and to find out that what your task is and to make sense of that scenario, you forget to read and memorize the name. And that depicts really badly if you go inside and you are unsure who are you talking to and who is the patient that you are talking about. So just whenever the first thing that you should do is just write the name and age of the child, write the name of the parent, and maybe just like speak it 1 to 2 times so you are clear. Because at times we have seen the candidates, they mix the names, then use the name of the parent as a name of the child and the name of the child as the name of the parent. So that's a bit confusing and that does not depict good, and it shows that you are like not very confident on all of this, right? So first thing is that write the names. After that, read the full scenario carefully. There are scenarios in which the diagnosis is given directly, right? You have been given that like maybe a patient child has presented and he has this and this and this, and echocardiography has been done and he has been diagnosed as like maybe a case of VSD, and you have to tell it to the parent. So the diagnosis is very clear. But there are times when the diagnosis is not been given, there are some clinical information that has been given, and you have to deduct a diagnosis from that scenario. Like, for example, in the last exam, there was a scenario in which the diagnosis was the coarctation of aorta, but the coarctation of aorta was not written as such. The clinical condition of the patient was described, it was given, and then after like the findings were given, and there was a BP readings that were given, and they had a difference, and according to that the candidate had to analyze that what the situation is and what do they have to tell it to the parents, right? So don't get confused, read the scenario very carefully, and maybe if you feel like it, that you obviously you cannot underline or like do that on the paper that has been given, but you can obviously write the important points on the white paper that you are given. So if you feel like it, you can write down the important points, so that in order to remember, like if there has been a scenario in which the child is having hyperbilirubinemia, he's having jaundice, and there are certain values that have been given, so you can write the values if there are certain tests that have been done and their results are being given, and you have to tell it to the parent that the results of the test, the lab results, you can write them down as well. So these are the things that you can do because you're going to take that paper inside. So do that, make a proper diagnosis, and your task after the scenario is being given, at the end there is a heading task, and after that it's written that what do you have to do. It's very, very important to realize first, after reading the scenario, you have to make it in your mind. I know if you are already preparing for the exam, you probably know there are multiple type of scenarios, from starting from the breaking bad news to an educational scenario to just an information giving scenario to a difficult colleague one, and like maybe an apology scenario, a medication error, ethical, whatever the categories have been made. You have to categorize the scenario, and then you have to realize the task. Is the task about telling the blood results to the child? Is the task about to the parent? Is the task about giving the diagnosis? Is the task just about like taking the consent? Whatever the seeing in your scenarios, you might have practiced like that particular scenario in some other form. And maybe you just, if you read a scenario, you're like, okay, fine, I have practiced it before. But the task in that very scenario, they might be different from what you have already practiced. So read all of it very carefully. And after that, have something in your mind, because I know whenever you will be appearing for exam, you must have prepared like maybe hundreds of communication stations. You must have practiced a few colleagues. So you do have a basic structure in your mind that I'm going to go through this, and this, and I'm going to practice like this. But maybe just like tell to yourself a starting line that how I'm going to start the station, so that when you are entering, you are in a proper zone, you're in a proper mood, a proper set of mind that you are going and discuss this thing, right? So like before going into the station, think ahead about your tone and your facial expressions. Like, how are you going to start? Obviously, if you're going to start, like if you are going into a breaking bad scenario, you won't be going in with a happy face, or you won't be going in with a like very chirpy voice. You have to have a very normal expressions, and maybe a normal um tone of your voice, right? So imagine that like the closer to the real life you imagine, the better you will score. Like imagine yourself in a real scenario. Imagine that the role player sitting is actually a parent who is having a child who has all these issues, and you are actually dealing with the child. So imagine yourself in a real scenario. Then you need to have some pointers in your mind that how do you want to direct or like maybe structure the conversation. I totally believe that like you have the communication, it does go according to the role player. The role player does direct you like in what direction he has to take you. Like if maybe he's just persisting on one typical point, and sorry, maybe the role player has something in mind and he's asking about that typical thing and he's going in that direction. But still, for the starting and obviously further, you should have some structure. It shouldn't be like that you are really uh like answering the questions. You should have something in your mind, and then you have to modify that information or that structure that you have in your mind according to the role player's concerns or questions. Then when you are outside, you can write the, like I've already told, that the important points that you have to cover. You have you can draw diagrams in any case. Some people are really good at drawing design, like drawing diagrams, making diagrams, and some people like really like telling things. Like I have one of the colleagues, and he likes telling things everything by drawing a diagram. So if you're good at it, if you feel like there's a diagram that could be drawn, especially where there are something like there's something about the kidney that you have to tell, maybe some procedure that you have to tell. So you can always take the help of a diagram, but remember that draw the diagram outside the station, because inside you won't be like doing able to do that. So if after reading the scenario you feel like there's a diagram to be drawn, just draw it outside. It does not have to be like a very hi-fi and very minute detailing diagram. It should be like understandable, like you should know that what you have you drawn, and like how would you tell it to the role player? Okay. What questions, like, you, if you have read the scenario and you have made up what you're going to tell, you can like maybe think about questions that may be asked. Obviously further, like, you always should have in your mind that you have to tell about the information sources, like uh in the summarization, and always keep yourself prepared for any type of the emotional responses that can come from the role player. You do not know that what is the mindset or what is the like the zone in which the role player is, because a lot of times, like if there's a scenario with a teenager, so it's highly predictable that the teenager is not going to listen to you very well. He's not going to respond to you in the first one, and he probably is going to be very, if there's some disease going on, he's probably going to be very upset. He's going to have some like maybe psychological issues, and he might sound depressed, and he might not be interested in talking to you, listening to you. So depending upon the scenario, just have a thing in your mind that how the role player will be, and how am I going to like involve the role player in the discussions. So other than obviously the information that you're going to give, the key points in any communication station is the first thing that you start with is your body language. Okay. So you enter the room, obviously you're going, and then you sit down. So our body language is that how you sit, how you are moving your hands, how have you placed your legs, how have you, how are your facial expressions. So you see at times, like we have this, like when we are nervous, so some people just start shaking their leg, right? Some people, it's not like very appropriate to sit like with the cross legs. You, it's probably like better to just sit with the normal closed legs. Keep your hands steady. The one of the very common things that we usually do in our daily conversation is that we use a lot of hands. So you can use at once or like once in a while, but tell like using sorry, did anyone ask any question? Okay, so I think maybe it was just, yeah. So it was probably yeah, someone just opened the mic. Okay, so body language is really, really important. How you sit, there's a safe distance that has been like maintained between the two chairs. So do not bend too forward. You do not have to go very near to the role player. You cannot, and then you do not use a lot of hand movements. Like there are people I've seen that who use a lot of hand to tell that what they're trying to tell. It tells that you are unable to communicate through the your verbalization, through your words, and you are using a lot of hand movements. Then your facial expressions have to be according to that scenario. Obviously if you're talking to someone, like if you're talking to a colleague, so obviously you would be happy, you would be like excited to talk. If you're just giving some information sharing, you're just making them study something, so you'll be like happy, you will be enthusiastic to tell. But in contrast to that, if you're talking to a mother who's like really, really upset, so you cannot just have a very sharp tone, or you cannot have a very high. So like that comes in the tone, but the body language is overall how you sit, how you look, how are your facial expressions, how are your hand movements, how are your leg movements. All of this is in your body language, and this does count. This does make a difference. Okay, because I actually tell you that, you see, no one goes into the exam blankly. Everyone has read. Everyone I know, like if because obviously there's a lot of repetition in the communication scenarios. So I believe that almost all of the candidates that are going to the station, they know what they have to tell. They know uh, the uh, the theory part. They know that what text or what information has to be given. It all depends how do you do it in that very 9 minutes with the role player, assessing the role player's needs and modifying your information giving, your expressions, everything according to that, right? So next comes the voice tone and pace. This is really important as well. So like I am talking to you right now, you might probably have noticed that if I have to stress on something, I would just pause and say that voice tone, and like anything, I will pause and I'm giving stress to something, right? I'm giving a pause. I'm not just saying making things, I'm reading something in a very typical one tone. This is usually what happens when you're talking to anyone. So what happens is that a lot of candidates, they do have the right information, the correct information, but they keep telling it in a very monotonous one pace. They do not alter the pitch or like of the space. I know this is a very person to person thing, and everyone has a different pace. Everyone has a different style of talking. If I say, if there are any Asians here, they must say that we Asians, we talk very fast. Even if I talk about myself, one of the things that I had to practice a lot in my communication is that I had to speak slower, because generally in journal practice, journal life, when I talk very fast, and at times it's not very understandable because that's my natural style. But for the communication, you have to modify it a bit. If you are very slow or if you are very monotonous, you have to modify and bring a little bit of the variation in your life, right? So it should, like, you shouldn't be too fast, you shouldn't be too slow. You should have a balance of all of these things, and you should know that where do you have to speak, maybe in a louder voice, in a more excited tone, and where do you have to lower down. Because you see, when we'll be going to discussing, we'll be discussing the breaking bad news. And whenever we are breaking a bad news, you have to be really, really slow. You have to tell it in a slow voice. If like that, you mean that you have to show that you are being empathetic. Or like in the cases of the medical errors or the apology scenarios, where you have made a mistake and you are saying sorry to that like particular role player, you have to tone down, and you have to like sound like you are actually apologetic, you are actually sorry that you are saying you have done that, right? So that's really important. So your body language, then comes your voice tone and pace. Next thing is your active listening. We whenever we are in the exam pressure or anxiety, we feel like that we know so many things, and we just have to tell all of those things. But what happens in that telling a lot of things is that you miss the active listening part. You are unable to basically listen to what the role player is saying, and that causes a real trouble, because that's even one of, like, we're going to discuss that what are the marking points in the communication station. So active listening is really, really important. During the listening, you can nod your head in between. You can say, I understand. You can say yes, no, anything, any remarks that you can give. But you have to give a sense of connection to the role player, that you are listening to them and you're understanding what they are saying. Then managing the concern, whatever the, do not ever feel like that you, like, if I am telling the diagnosis and I say that maybe your child is having ventricular septal defect, and you know what happens in ventricular septal defect is that there's a hole in between, and in between the role players has a concern and he's asking about a concern, but I feel like that no, if I break my momentum right now, I might not be able to tell the things properly, and I don't stop and I don't listen to what their concern is, and I keep on going according to what my like what I want to tell, that is going to cause a negative marking as well. Always listen to the parent. If you feel like that you are addressing the concern, then tell that I'm telling you this. If you feel like that you can answer the concern later, at least tell them, okay, I'm going to answer to this question later on. Let me tell you this first, right? Or at times, if you don't know the answer, you can always say that I will check it, I will tell it to you later. Because you know I've written that correct information is really important. Never ever give wrong information. If you do not know something, because obviously we are humans, we might have read something, we do not know it at that point of time. It's okay. It happens all the time, because you see, we're always looking in the books and we're always looking at the guidelines. So just as you can say that I'm going to I am going to ask, or I'm going to discuss this with my consultant. I will come back to you, or maybe I will check it and I will we can have another meeting to discuss this. Okay, you can say that, right? Give pauses when needed. It means that whenever you have given some information to the parent, and there's a lot of information, like when you have given like a bad news, give pause, let the patient tell show their expressions, whatever it is. Give pauses in between and check the understanding, right? It's always, if maybe you have told all of the things, but the role player seems blank, he does not seem to understand what you have said, it would not make a good communication station, and you might not be marked properly for that. So always check for the understanding in between. You can say like, am I making myself clear? I hope I have made my point clear. Is this like clear to you? Once or maybe twice in the communication station, right? And choice of the words is very important. I always emphasize that you should have proper comforting lines to say to the role players. You know that we do not have to use a lot of medical words, so you should know that what medical term is like, should like, what is the replacement of that medical term, proper words, proper sentences. These are really important. So this is just for the overall scenario of the communication. So any communication station has three parts: introduction, main body, and the conclusion. The good thing is that introduction and conclusion is like a similar one, and they do have proper marks. So I always tell it to the candidates that if you get a scenario in your exam and you feel like that, I have never ever seen this scenario before, I do not know what am I going to tell. Again, even in that condition, do not panic, because you see, you do have separate marks for the introduction and the conclusion. And if you're going to do that, fine, you are going to be marked for that. So if you don't know a lot of information, just by your body language, just by your communication style, you still can score some marks in the communication. So do not panic, and like, practice properly for all of these parts. So introduction is really important, and I would suggest you that if you have started preparing for the exam and you're practicing for it, focus on the introduction, because you see, introduction is your first encounter, like your first interaction with the role player. It's your first impression on the examiner as well. If you're going to be shaky in your introduction, if you forget something, if you're not able to build a good rapport with the role player, it may not give a good impact on the overall scenario, and it might, like, it does not maybe like tell the role, it does not allow you to make a good connection with the role player as well. Okay, so some things are unnecessary. I've seen a lot of candidates who are preparing, they use the lines that, I have made the arrangements that no one disturbs us and we will sit in peace, or some things like that. I personally feel that they are not necessary, because the situation, the setting has already been told in the scenario, and this is like just like a waste of your time. Okay, so personally I feel like that for the introduction, first thing is to introduce yourself. Always introduce yourself. Hello, good morning, whatever you want to say. My name is Dr. Iqra. I'm one of the pediatric registrars here, or one of the doctors here, whatever you feel like saying. Okay. Whenever you are talking to a teenager, avoid using the word child doctor or the pediatric doctor, because the teenager, at times they say that they get offended by the fact that, okay, you think I'm a child or things like that. You can just use doctor or whatever you feel comfortable with. Okay. But it should be your introduction. Secondly, when like closer to the exam, not now, but the closer to the exam, when you feel like that you have got the date and you know that is your exam in the morning or in the evening, keep practicing that like, do you have to say good morning or good evening, because that matters. What you have practiced, that is going to come out of your mouth spontaneously at that time. After that, confirm the identity. Like, you have known the names, but you have to confirm that you are talking to the right person. So I believe I'm talking to Mrs. John, father of Adam, like mother of Adam. So confirm that it's like, introduce yourself and confirm their identity. That's important. And after that, you have to build rapport. Rapport, you do not have to have an extensive conversation, but a single line. Maybe like, if there's a newborn, always congratulate the parents, ask about their health. If you are talking to a junior, a colleague, always say a line about their performance, about like encouraging them, about saying that I've heard some really good reviews about that. Anything, right? What I prefer and what I guide, that avoid asking how are you. Okay, why? Because if you are like straightforwardly, you have asked how are you to the parent who was really upset, And so he's going to just start whining or just start saying at that very moment that I'm very upset and this has gone wrong with my child and blah, blah, blah. And that's going to cut your momentum. So do not avoid asking, how are you? Just ask a general question or just ask, like maybe a congratulate or to say a sing line. So build rapport is important. After that, you have to clarify your role. That's important. You are going to mark for that. You have to tell it to the parent clearly. Okay, now this is not that you have to tell it that I'm going to tell you about the disease of your child, or you can have a journal line. Today, I'm here to talk to you about John, John's condition or John's health update or anything like that. Why you are here, or maybe say that we have received a letter from your GP and uh, am I audible to all of you? Can anyone please message? Is my voice clear? Okay, because there was a connection, like there was an internet issue in between. Thank you so much for responding. Okay, so you have to tell the rule, your clarification, but you do not have to tell it in that very moment, the exact diagnosis. Like if you are taking permission for a procedure, you do not have to tell in very clearly that I'm going to take, like today I'm going to take permission for the lumbar puncture, right? You're going to say that today I'm going to discuss with you about certain investigation or the certain plan that we have for your child, and maybe by the end of this conversation we can have your permission, right? Or like if I'm going to talk to you about journal health, and I'm going to anything like send but a journalized sentence, but tell it that why are you here about talking about that their child. Then it's ask for the tender. That's really important. You have to ask. You can always ask, you can use these sentences. Do you think this is a good time? Like, I'm here to talk to you about John. Do you think it's a good time? So they're going to say yes. Okay. So about asking the tender, that do they want any of the persons to be there? Okay, so you can say it like that, that do you want someone to be here with us today or do you want me to start? So most obviously they're going to say that like you can start. Uh, Attendant is always or like it is important to ask for the attendant in almost all the scenarios except for a few. One of them is when you are talking to a colleague who has done something wrong, and you are going like if they have made a mistake or something like that, and you are discussing with them of they've come to duty late or any of the difficult colleague scenarios, then you're not going to ask for the attendant because obviously that's a very private conversation. Then in the cases of the ethical scenarios, like when you have to like tell the diagnosis of maybe HIV or any other thing like that, which is probably something like not very common, you can avoid attendance at that point of time. And in the cases of teenagers, you have to be careful about asking for the attendant. You can ask for them, but at times they do get irritated. That do you think like I'm a baby and I need a babysitter, I don't need a babysitter, something like that. So you can always say made you feel that way. We just want to make you comfortable and we'll just have a discussion with you if you're comfortable that way. Or you can ask them that I'm here to talk to you about your health. Do you want someone to be here with us or do you feel like you're comfortable alone? Anything which is comfortable to you. Cases of the teenagers, but you have to be a bit careful about your words. And then you always have to ask about the previous knowledge, that what is your update about John's health, or what do you know about his condition, and how is he doing now, or anything like that. So to have an idea, because obviously they have given you certain information in the scenario that has been given outside, but after, by asking this, you're going to have a journal idea that what is in the mind. Like if you're asking the what's your update, so the parent might go like, I'm really upset about it, I'm really upset, I don't know what's going on and this thing is happening to my child, and like so you'll get to know that the parents is really worried. Or there can be something like you get to know about the condition, the mental health, or anything like that. Or maybe they have been told the condition, but they do not know about it. So you always have to check about the connect. Like so, this is the basic things of the introduction that you have to do in every scenario, and it's the same in every scenario. So practice them very well. Avoid using ahs, ums, avoid forgetting names, avoid using too long sentences, avoid asking direct questions in here, and just have a very smooth introduction. And it should be probably around in less than a minute, because usually we say that if you have to tell, if they have to give you an information to the parent, bad news, something like that, it should be like in 1 to 1.5 minutes, right? So introduction is the same. In marking, you see that when you are marked, there are 8 marks for the communication station. 2 marks are for the overall communication style, repo, and communication. Like this is your initial part. So why? How are you marked? There should be appropriate level of confidence, greeting and introduction, professional, sensitive, appropriate body language, response to verbal and non-verbal cues. So this is from the MRCPCH, the guidelines they have given, and the anchor statements, like the basis on which you are marked. So you see, it's all of things are written. You are marked according to all of these things. Develops appropriate rapport with the role player, puts at ease. See, so rapport building, having a connection with the role player, that's really important. Then clarifies role, shared agenda, appropriate tone and pace. So all of the things that I've told you till now, these are marked. So this for the 2 marks, you are assessing 2 marks for this. So if even if you do not know the single bit of the topic that has to be told, if you are doing this, you are greeting properly, you're doing all of these things, you are going to get 2 marks for this, right? So it's really important. After the introduction, there comes the body of the communication. Body is different for each scenario. I'm sure that you probably have been practicing. You guys have gone through all the scenarios and you know that how each structure of each the communication go. We're not going to go into the detail of all of them right now, but you know that you have there are different scenarios. The common thing is that you have to give factually correct information. If not known, you can always say that, like I will tell you, I will check and tell it to you later on. An important thing is never make it a monologue. It's a dialogue between two people. Always say something, listen to them, respond to them. Do not just keep on telling your own thing. Do not speak long sentences. You give your information, whatever information that you have to give to the role player, give it in small, crisp, accurate sentences, and then respond for their response, like wait for the response, and then respond further by like managing those concerns. One thing is very common, that even in the role in a communication station, if you have not satisfied the role player properly in a certain context or a certain thing, they are going to keep on repeating that question again and again. So if a role player is asking a question again and again, just realize there are certain, there's always a catch point in a scenario that you have to answer to get the full marks. So if a role player is asking a question again and again, do not get offended by that. Realize that he's doing it to help you, so that you can answer it well and you can score well, okay? But avoid using a lot of long sentences, and avoid using jargons. Like the medical terms that you cannot use in the scenarios, like you cannot use the word, if I give you example, there's a whole list. There's probably a notes, a book, probably a book is there as well, in which you can always look for jargons. But usually, like, you cannot take the name of the specialties. Like, you're not going to say that I'm going to refer to you to a cardiologist. You are going to say that I'm going to refer to you a heart doctor. Similarly, an endocrinologist is a gland doctor or a hormone doctor. A nephrologist is a kidney doctor. Abdomen word is not used. Tummy word is used. So all of these medical terms that we are used to, they are not to be used with a common man. This is for the exception. If you are talking to a medical student or a doctor or colleague, you can always use those with them. But avoid using jargon. If you feel like you have used a jargon, then just explain to you that, like, if you have used a term that you feel is not appropriate, then give it clarification in the next sentence and clear to the rule. I remember in one of my scenarios, I used the word drugs instead of the medication, because the word medication or the medicine is used, and I used the word drug and it was not the right word. So they wrote it in my explanation for and they wrote it that you use the word drug. So they do take that thing very particularly. So this is rest. Like I told you, the 2 marks in the communication station were of the rapport building communication style. Next, 2 marks are each of these. A2, like the information sharing and accuracy of the information, 2 marks are for this. It involves that you explain relevant, clinically accurate information. Information is provided in a well-structured manner. Like if you are explaining the diagnosis of a disease of a cardiac lesion, you have to explain it in a very appropriate way. You cannot just randomly say a lot of lines which are not making sense, right? Then verifies the understanding, as I told you that like you have to ask them that they are if they have any confusion and they can ask any question, and then summarizes you, and the end you have to give the summary of this. Then E2 is verbal listening and communication style skills. Like I told you earlier, that the candidate applies active listening and displays interest with the role player. As I told you that it shouldn't be monologue, it should be a dialogue, appropriate language used in the challenging circumstances with any jargon explained. So if you have used any difficult word, you just have to explain it. Then managing concerns and agreeing to the next step. Seeks, identifies, acknowledges, attempts to address the concerns appropriately, displays natural empathy with the role player. That's very important. That is, empathy is shown with your gestures and with your words, your tone as well. Checks knowledge and understanding and agrees to the next step. As I told you earlier, that if you are just telling your information and you are not making it a routine to check it and verify that has the role player understood what you have to, and then you're gonna get. I remember in one of, like I told you, as I told you that the one I still remember one of the comments of the examiner, that you give too much information to the role player without considering that the role player is not actively listening. That scenario was with a teenager, and she had this. Maybe you have gone through that. There was a scenario of oculogyric crisis, and like I was unable to explain it in a very like appropriate manner. So I think I got 5 out of 8 in that station. So, but this is important. All of these things, right? And at the end, there's a conclusion in which you have to summarize whatever you have told. Usually, the candidate summarize, but in the cases where you are talking to a medical student or a colleague, you can get summarization from them. Offer further meeting if needed. Provide written information, leaflet, websites. You have to offer them obviously in support groups. So remember, one other thing that a lot of candidates tend to do is that whenever there's a bell, whenever the bell rings in, they immediately start wrapping up. Like I've seen role players who are practicing that they immediately start wrapping up. They end the scenario in probably 1 or 1.5 minutes earlier. That's not the right thing. The bell that has gone, that you start wrapping up, you start doing that, but it's not that you have to just end it in an instant. You can always take some time and just take it slowly. And but it's always suggested that do not, if when you are towards the end of the scenario and you are about to summarize, do not ask that if you have further concerns, because if there's any concern that has been asked at the end and you are unable to um c- if you're unable to clear that, that's going to create a trouble for you that as well, right? So just maintain a balance. You should ideally be using all of your time, but if you are ending early, it shouldn't be like that. You shouldn't be leaving more than 30 seconds in the conversation. It means that if you have ended your conversation at probably 7 minutes or 7.5 minutes or 8 minutes, it means that you have missed some important points in between, right? So do not end it abruptly in a very sudden manner. Okay, so now we come to the breaking bad news that we are specifically going to discuss and the important points for that. So this is like in the official statement of the MRCPCH, the guidance that they've given, they've written it in the similar way that in the particular scenario of breaking bad news, it's important to realize that there is no good way to break a bad news. It's always going to be bad news. So how we going to see that what are the important things that we can keep in mind while we are breaking bad news. Remember one thing in mind: you have to be open and honest about the diagnosis. You cannot say that you do not have to avoid telling the right diagnosis due to the fear that the mother or the role player would be upset about that. You have to tell the
exact name of the diagnosis. We at times feel like that we just tell them that there's something wrong with them. Like if you're telling the heart issue, you're saying that probably he's having a hole in that. So you do have to tell that there's a hole, but you first have to tell that your child is having a condition which is called ventricular septal defect. You have to take the name of the disease or the condition and then ask that, do you have any idea what this condition is? And obviously, the mother is going to the parent is maybe going to tell you that no, we do not know. And then you have to explain that what that condition is. But first thing is that you have to tell it in a proper tone or a proper way that what exactly the diagnosis or the condition is. So, introduction in a breaking bad news, you have to be empathetic. You have to be like very considerate, talk in a normal tone. Then you have to see that what they already know, that we have discussed in the introduction, that what they already know. So probably when there's a breaking bad news, the parents are going to tell you that my child has been unwell and they have an issue, and the doctor has said that they'll be doing some tests and we haven't got any response to that, and whatever it is. So they will have a general idea of their child. So do show some empathy that, oh, I understand that that's difficult for you. So that is why I am here. We have got the test of the like results of the test, and like we have got to know whatever it is, right? Warning shot. What is warning shot? Warning shot means that do not tell them that, okay, we have got the results and your child has acute leukemia, right? Do not say it like that. You have to send them a sign that something bad is coming up, right? So how would you do that? You would say that, Mrs. John, we have received the lab results of your child, and I'm really afraid to tell you, or I'm really sorry to tell you that unfortunately he has a condition that we called acute leukemia. Okay, thing like that. Always use the words, I am sorry to tell you, I'm afraid, like unfortunately, something like that. Okay, do not just directly say the name of the disease or whatever it is, right? But saying, having said that, the using the words, you have to deliver the bad news by telling the exact diagnosis and then explaining the diagnosis, the detail of that. So after you have told it in a normal, maybe a little lower voice, I'm really really sorry to tell you that unfortunately he has got a disease and it is called this and whatever it is, like, then after that, give a pause. Do not start explaining what it is at that very moment. Take a pause, just stop talking after telling their diagnosis and let the parents react. You have no idea how bad the reactions can be. Like I remember one of the scenarios, I have had one of the role players who, like when I gave the breaking bad news of the acute leukemia, the mother literally started crying and wailing, and you have to go through that. You have to let them vent out. So wait for the emotional response, let them vent out. Time, offer them water. You can offer them water, you can offer them tissue. You can even say that I can understand that you are really upset. If you do, you want me to stop right now or do you want to continue? Just but give them a few good seconds to let them out and just be empathetic in your tone, in your voice, and your right. Do not rush. Do not think that, oh my God, she's taking such a long time to vent it out. How am I going to tell you that? I'm going to tell her that what the leukemia is. How am I going to tell all the information that I have to tell? No, that's not important to tell. It's important to just let them vent out and regulate their emotions. And when they say things and when they are saying something, do not interrupt them. Let them say what they want to say. And if maybe, at times there are times when uh, there are times when they start asking a lot of questions at once. Why, how did this happen? Why my child? Is this more like they ask 4 or 5 questions at one time. You can tell them, I can understand that you have a lot of questions in your mind. Let me answer all of your queries one by one, and then start answering the queries one by one, right? So it's really, really important breaking bad news to break the bad news, give a pause, give them space to um give them space to just vent out everything, and then ask them to proceed further. And then just keep on checking the understanding. Do not overwhelm them with a lot of information at one time. Go step by step by just telling about the diagnosis, what exactly the diagnosis is, what are we planning to do. And then obviously the role player is going to lead you towards, maybe there are some role players who want more of what is going to happen. Some role players would be emphasizing on why it has happened. Some would be more interested in knowing that what would be the treatment, would my child survive. Some would be interested in knowing about the next pregnancy. So it depends upon the role player, right? Then use proper comforting lines. We usually generally tend to say this whenever someone is upset, and we say, don't worry. But you cannot tell it to a parent that you have diagnosed your child with I am sorry, I got disconnected. Okay. Yeah. So I was saying that do not just keep on saying that don't worry, right? You have to use appropriate sentences, and their sentences have to be different from scenario to scenario. But it's always a good thing to acknowledge and verbalize their emotions, to recognize their emotions, tell them that you understand what they are feeling. Like if in a case of a medical error, you feel that they're feeling angry, tell them that we know that you are angry, you're frustrated, and you have the right to do so. And like verbalize the feelings and let them know that you understand that, right? And again, use the right words, proper tone, give precise information in short phrases. Do not overburden them with knowledge. There's always there's always staircase. You have to tell them the first level of the information, and if they have understood that, then only you can go towards the next level. You cannot just tell them the ending point, the treatment and everything, if they do not have understand the basics of them, right? And then, as I already told you, that every scenario is going to be different. Each role player is going to ask you different question. You have to tell them according to that. If they're not very interested in maybe the diagnostic procedures, or in maybe the symptoms and all, if they're more interested in just about the treatment, we have to tell them about the treatment, its duration and everything. Obviously, you're not going to tell them the details of that. You're going to tell them that it's going to be a long treatment. We are going to refer you to the like the cancer doctor. They're going to tell you all of the things in detail and all of those things, because you as a registrar, you're not going to tell them, like if there's a diagnosis of BST or something like that, you're not going to explain to them that what surgery is going to be. We're just going to tell them that we are going to refer you to a heart doctor, and more probably they will be discussing it with a surgery doctor as well, and they will telling you about that, or things like that. So you have to tell you about the proper reference, a bit of a knowledge of how it's going to happen, how will be the like a bit of a prognosis or something like that, and how you can help, and answered all of the concerns. As I already told you, that if a role player is bringing up a certain topic again and again, again and again, then it means that you have missed some important vital information that has to be given, and you need to tell that to score the marks, right? So this is probably all about what I had in my mind to tell it to you. We are open to take any questions, any confusions, if any of the participants want to ask anything, and then we'll be going towards the scenario that we have planned to discuss. So, any questions, any remarks, any confusions that you guys want to clear? So, just like you can just open your mic and ask, or maybe just write down in the chat. It's always a good idea to ask questions. No, this is a total like judgment-free zone. We're not going to judge you. We know there are people who are just have maybe this is their first orientation session. They do not know a single bit of it. So ask.
Hello. I have a one question that
Hello, yes.
good day. Yeah, my name is Dr. A.
Yeah.
Uh, Once you, after the, the breaking, you explain the page, sorry, the role player, and then do you have to stay, have the discussion with the examiner, or you just have to explain the role player alone within that 9 minutes?
No. In the communication, you do not even have to look at the examiner. Okay,
Okay. After
you do
the
not have to interact a little. Yeah, there's no interaction with the examiner at all. As I mentioned in the earlier, that when you are going to enter the station, the examiner is just going to introduce himself, is going to tell you
Yes.
that this is the there and start your
Yeah.
task. Then
Okay.
there are two chairs facing each other, and you are going to sit, and whole of the 9 minutes you have to talk to the role player. The
Yeah.
examiner
Okay.
is sitting on one side and he's just marking you. He's not going to comment on anything. He's not going to tell you that you are doing something wrong. He's not going to appreciate you for something, nothing at all. It says like he's non-existent, right? You are
Okay.
going to talk to the man in the role player in all of the time. And once the time is over, you are going to get up and go outside. There's no interaction with the examiner at all.
All right. Thank you. Thank for the answer.
Thank you for asking. Yeah. Does anyone have any other question?
Yes.
Any basic,
Will we-
anything? Yes,
Yes.
Dr. Dhamendra.
Yes. Then if we complete our task in 7 minutes, still 2 minutes are remaining, and we forget to tell something.
Yes.
Then in the end, in summary, we can tell to the role player. Hello.
Post and you have summarized the case, it's not really
Yes.
recommended that you answer the or you talk again and discuss something else. It's not recommended, right? It's because once you if you have not summarized yet, you're still in the process of the summary and you feel like telling something, maybe you can tell it at that time. But once you have summarized, you have told about the information, leaflets, or anything, there's a pause. If even if there's 2 minutes left, then you, the role player examiner, they're going to stay silent in those 2 minutes. Maybe if the examiner wants to say something, he might say something, but ideally, no, you do not have to tell that. So it's that's why you have, because you see, you're not going to have watches on your hands or on your wrist in the exam. So this comes with a practice. You have to know that after the bell, how much time you have and how much sentences you can say. That comes with the practice. So when you are going to practice for the exam, you are going to witness is that with the time you will realize that you will understand that after the like maybe after the bell has rung of the 6 minutes, you probably have around a minute to say your own thing, whatever you are saying it, and then start summarizing. Take any other things and then just, and if you're feeling like that maybe you are ending it too early, maybe just like prolong the summary a bit to prolong the scenario and lessen the ending time, right? But this comes with the practice, and ideally you should be using like almost all of the time, but and not leaving more than 30 seconds at the end.
Okay. Thank you.
Yeah, you're welcome. Any other questions? Okay, so if not, then we have quite a few participants here. Would anyone like to volunteer for our practice scenario? Anyone? Even if you're starting, if maybe you can just, if you're not feeling like doing the whole scenario, maybe you can just do the introduction or anything, and I can assure you that this is going to really boost your confidence and help you. Okay, Dr. Imran. Okay, thank you so much, Dr. Imran, for like volunteering. That we really appreciate that, because this is going to be a learning for you and for the other candidates as well. So we are going to do this on the exam pattern. I'm going to show you the scenario, and you will be having 3 minutes for your preparation. Let me know when you are ready and you have your paper and pen with you. Just let me know.
Yeah. Okay.
Yeah, just a second. We have a question. Someone's asking that I want to ask that do we need to proceed to explain regarding management after explaining about like, yeah, so ideally in a in a structure, when you are practicing, you do have to practice in a way that you are going to tell the what exactly the diagnosis is, and maybe some investigation or things like that, and a bit of a management. Yes, you ideally it should be in this manner. And in most of the scenarios, like whenever we take feedback, the communication does go like that, that after knowing about the disease, and because whenever there's a breaking bad scenario, the parent would have some initial response, then they want to know what the disease is, then they want to know that why did this happen, so you have to tell something about the cause of the disease. And then mostly the parents would say that, is it my fault, why did this happen to my child, is it because of me, they're going to go into some self blaming things like that. And then after that they will eventually come to the management. So you should have something points about the management, and then in the management they probably have some other questions. Probably they would ask about how, like, would he survive, would he die, how long would the treatment be, and what side effects, even they can cite about the side effects, and they can ask anything about that. So yes, generally in the scenarios of the information giving and the breaking bad news, the scenario does proceed towards the management part, right? Okay, so Dr. Imran, I'm going to share the scenario with you, and you have 3 minutes to prepare for the scenario. If you are ready
Okay,
in the before 3 minutes, let me know, we can start.
okay.
So the time is up. Let's just start.
Yeah, okay. Hello, good afternoon.
Good afternoon.
I'm Imran, Dr. Imran, one of the pediatric registrars here in the hospital today. I
Yes,
believe I'm
doctor.
talking to Mrs. Matthew, mother of John. Am I true?
Yes, doctor, that's me.
Okay. Mrs. Matthew, I am here to discuss with you about John's condition. So before we discuss further, would you like anyone else to be here with us today?
Oh, no, doctor, you can continue. It's only me. My husband is away.
Okay. So, Mrs. Matthew, as you know that John has been sick for the last 1 month and he has been having symptoms like fever and letharginess.
Yes, doctor.
So yeah, so we did some tests for him
Yes, doctor, I've
and
been waiting
we
for the results. I don't know. I mean, I have brought him to the emergency and I'm just waiting for so long. No one has told me that what's going on, and everyone just is going around and they seem worried, but no one is telling me anything. What's going on?
okay, I shall explain to you and if you are unable to understand anything, you can let me know. Okay.
Yes, please, doctor, tell me
So
what is going on.
yeah, so the blood tests which we did for John, uh, they unfortunately, I'm afraid to tell you that unfortunately they were uh, positive, suggestive of a condition called acute leukemia.
Sorry, doctor, what? I mean, I really don't understand what is acute leukemia and what are you saying? I don't know what's that.
Yeah, I understand your worries. I know it's a difficult time for you, and
Doctor, what is that? I
but I
mean,
want
is it something serious? Is it dangerous? Because I know my child is not well and he has having fever for 1 month and now he has all of these thing like this bruises on the body and I feel that something's really, really bad going on with my child. And now you're telling me, what is this, doctor?
okay. Acute leukemia is a condition in which there is involvement of our bone marrow, and bone marrow
I
is
so what happens basically, doctor? I mean, are you telling me that does she have cancer? Does my boy has cancer?
yes. Unfortunately, it's a type of cancer,
Oh my
and
God,
but the
doctor,
good thing is,
what? He has cancer? Are you sure? Maybe it's wrong. Maybe he just has some infection and he's having some fever. How can you say that, doctor? This is I'm so upset. How did my child had all of this and why are you sure about that? Maybe you can do some other tests.
yes, mom, I can see how much you are worried about your child, about your son John. But I want to assure you that the good thing is that this is a treatable condition,
I
and with good treatment,
just told me about
majority
my
of the
child.
children they got better. Yes,
Yeah, you just told me how is it a good thing? I don't understand that. Doctor, I don't know how
yeah.
my child because of me. I should have brought him earlier. I mean, I've been waiting and giving him medicines for 1 month. Is it because I delayed it? Has he worsened because of that?
Yes, mom, I can see how much worried you are right now, and anyone in your position will feel the same way. But just as I've told you that this is a
Uh,
treatable condition, and
so, doctor, are you sure, or you are going to do some other tests as well?
yes, we shall first confirm our diagnosis. As the test results are positive for this condition, so we will go for another procedure, which is called bone marrow examination, and
So,
it's a
so,
simple
so, doctor,
procedure. Just
you think is there a chance that he does not have that?
right now, it is almost uh, clear that John is having this condition, but still we shall perform this test, just which I have
Oh,
told you, bone marrow examination.
this seems so
To
bad. My poor child, he's so young. How he's going to go through all of this? And I don't know. My husband is not here as well. He is just away. And how this going to work? How are you going to treat him, doctor?
yes, and there is a team of specialized doctors which will be taking care of John in future, and I want to assure you that we will
My child going to
uh,
die. Is my child going to die?
No, it's not like the way as you're thinking right now. As I have told you that majority of the children, they do, they do, they get better with the treatment given to them for this condition over time. And although it takes, although it's a long treatment, but I want to
How
assure
long?
you that majority of the
How?
children they get better. Yeah,
I'm so upset, doctor. How did this happen to my child? Why did this happen to my child?
actually, yes, it is not your fault, and it is not the fault of your little son John. As there are many different reasons for it, and right now we cannot say that exactly to you that what is the exact reason for why John got this condition.
Three
But
minutes. 3 minutes left. So, doctor,
okay,
how, is the treatment going to be some medicine or some other things?
yes, we need to give some. We shall need to give some medications to John. But all, but but this will be decided by the specialized doctor called cancer doctor, and it's the and for that we will
No, no,
send you.
doctor, I don't know how to take. Nothing is making sense right now. It's all so much. I cannot take all of this. It's so hard to just accept. I don't know what to do
Okay,
and what will happen.
yeah, there is no need to worry right now, as I
How,
shall
doctor?
definitely.
How shouldn't I worry? You just told me that my child has cancer, and now you're telling me not to worry.
Yes, your child has cancer, but the good thing is that it's a curable condition, and majority of the children they do better over time. And they get better with the latest treatment which we have for this condition.
I don't know, doctor.
And we
I'm so
also
upset, and I don't know how it is gonna be. I don't know. Maybe.
okay, I shall arrange a meeting for you for further information with the specialist doctors who are going to treat John later uh, about this condition for this condition, and
You're fine, doctor. I
I
think
shall.
I just need to think about all of this.
Okay,
I need to
okay,
think what can I do.
okay. You can take your time. You can take your time. You can discuss this condition with your husband, and we can have a further meeting with you again. Okay. So
Yeah,
just okay. If you're comfortable, then just I shall just summarize for you what we have discussed today. Today we discussed about your son John's condition. I told you that he has been diagnosed with a condition called acute leukemia, and I told you that he will further need a specific test for bone marrow examination to further confirm our diagnosis. And I told you that we will soon arrange a meeting for you with the specialist doctors and his team who is going to treat John. Okay,
yes,
and I can give you some leaflets. In meanwhile, you can read those leaflets, and there are some specific websites from where you can get more information about this condition.
yeah.
Okay,
That would be good. Yes, doctor. Okay.
okay, and if you want. I can also have a meeting with you with my consultant in future.
Yeah, doctor. Right now, I just need to
Okay,
process all of the information that you've told me.
okay. Thanks for giving me your time today.
Yeah, thank you, doctor. Okay. Yeah, it's only 6 seconds left. Okay. Okay, so Dr. Imran, okay, well, how do you feel? How did you do?
Just I try to give some empathy to the mother and explain the diagnosis
Yeah,
step by
so
step.
have you been practicing?
Previously, I used to practice, but for a long time there is no practice.
Okay, so are you planning to give exam anytime soon?
Yes, I shall take the next one, whichever it will be in Pakistan.
Okay, okay, that's right. That's a good thing. Okay, so I personally felt that you did really well regarding almost all of the scenario. Um, if you start, you did introduction and all that well. You did miss to ask the update of the child. You start telling that we know all of this. You can go that way. That's not totally wrong. I would say that you told that as we know, but it's not really a considered good that you tell what has already been told. because you know that the child has this and this and these problems, and the mother knows. So it's better to ask it from the mother, that how does he feel that the child is doing, rather than just telling it yourself. So you missed that one point of the introduction, the prior knowledge. Other than that, I think you did well. Maybe with the time, obviously, in such scenarios, like in the Breaking Bad news, it's difficult to make a rapport. So it's fine to just go directly to the tender. But in the other scenarios, just make sure to add a few a line or of regarding um the repo building as well. Regarding telling the diagnosis, yes, it was okay. It could have been more smoother, like it could have been more of empathetic, and a bit. I felt that it could have been a bit better just about telling them. Other than that, you could have drawn a diagram as well and explained it to that. So you see, the bone marrow, it doesn't really make sense. So you could have explained it that that our blood has three types. Like we have, you could have tell it that his blood test has come, and it shows that he is having some cells, the abnormal cells in them, which shows that he's most likely having this condition. So he would say that there's something related to the cells, or something related to the blood issue going on, because telling directly about the bone marrow and all that, that comes out to be a jargon. You could have drawn a bone marrow. You could have told that, you see, in the our blood is made in our bones, and when there is at times it happens is that something goes wrong in them, and there's a excessive production of a lot of cells, which leads to the some issues, some problems in the child, and due to that he is having certain cells are more than the normal, and certain cells are less than the normals, and that is why he's having the symptoms of uh these, like fatigability and this as well. So a condition could have been explained a bit earlier, but I understand the in between part, the pause, the emotional response. You did that well. You did give the time. Explanation of the diagnosis could have been a bit better. With the time, when you will keep on like practicing the scenario, you will get to practice, and you will understand that how each diagnosis is being told, right? So they you have to tell it in a proper line. After that, I think you did do right. They don't blame yourself, and he's going to be better, and that, but it needed a bit of a more uh I always say that doing practice online does have its pros and cons as well, because at times obviously you're not seeing the person next to you, and it does not make a full connection, so it does feel that a bit disconnected one. So whenever you practice for your exam, do try to practice online as well, but do always try to practice someone in live, in real scenario, so that you understand their tone, so you understand their like facial expression, then you can respond those things to well. I'm sure like you did say it in your voice, but if some role player is sitting in front of you in a live scenario, you will do better with the with connecting and with empathizing and things like that. And after that, you did fine about the summarization. The timing was fine as well. So overall, I would really say that you did well. A few it just need a bit more of a polishing, that obviously when you're going to practice in future and going for the further like practices, you will do that well, right? So a very good performance. Thank you so much for coming like forward and practicing. I hope it was a good learning experience for rest of the candidate as well. If any of the other candidates have any remarks, anything that they want to add, any comments, they are more than welcome to just share their thoughts, or any questions if anyone wants to ask, and then we can just wrap up today's session.
Uh,
And yeah,
can we say don't worry to the role player
yeah,
that
yeah, yeah, I did mention that.
okay,
Just
because earlier we told that we don't have to say
yes,
don't worry.
because you see, but it happens, it does happen. That's what I tell, that when you are in the scenario doing that, a lot of things that do not have to be done. Like I told you that I practiced communication for more than a year. And then again, in the communication scenario, I did get confused about certain things. So these things, but yes, you pointed out really well. that don't worry. That's why I say that whenever you guys are practicing and started preparing, write your lines, that because everyone cannot say the typical lines in, like everyone cannot say the similar lines, right? It's all, everyone has a different way of saying things, everyone has different words that have to be used. So use words that you are comfortable with and that comes out from your mouth without any hesitation and comfortably. So do use that and make your own comfort sentences, write them down and just use them. Okay, so someone, if I want to ask, if the parent asks, "Is my child going to die, or is the diagnosis confirmed?" What would the most appropriate? Okay, so this is a very common one. The Yeah, so it's very common. They say that my child is going to die. So you have to comfort. Then I'm so sorry that you feel this way. But you see that this condition that he has been diagnosed with is a treatable disease, and we have a lot of patients that who do really well after the treatment and who live near normal life once they have gone through all of the treatment, right? You cannot directly say yes or you cannot directly say no. You can tell them the positive findings, like the positive aspect, obviously, that because most of the scenarios that does come in the Breaking Bad news, like about the cardiac lesions and all that, all of them are mostly treatable, right? Or there are certain syndromes that you have to tell, like if in the case of a Down syndrome, then you say, if they say that how much time am I going to die, you do say that many children lead near normal life, or they come back to the normal life after the treatment, and they have a long lifespan, and they do just as well like the normal
Madam,
kids.
madam,
Yes.
can we say percentage of the disease prognosis, like ALL is a 60% prognosis
If you have
survival?
Okay. If you have exact NHS data that you are in the proper guidelines, that you know, it's not about the local data. If you have actual NHS data and you remind that very accurately in your communication station in your exam, then yes, you can say that. Like in the cases of the preterm neonates, certain people do mention that the survival rate at this age is this much and this much. But if you have a little bit of a confusion, then you do not really need to put yourself in trouble by saying a certain percentage. It's always good to say that most of them or majority of them, and we see a lot of children who get very well and they do normal after that. So don't think about the worst condition right now.
Okay, madam.
Okay, and what would be the if the diagnosis is confirmed? If it depends on the scenario, if in the scenario it has been mentioned that the diagnosis has been confirmed, like in this test, like you say that there's a high chance because we have seen the abnormal cells in the blood, but for the confirmation, we are going to do the test. Like in the cases of the Down syndrome, there's a scenario when in the scenario it's written that you have found that the child is having certain features and you tell parents that we are suspecting Down syndrome with this all of these features, but we are going to confirm it on the labs. So if the mother asks, then you have to say that on our clinical suspicion and on the preliminary, we do have a high percentage, like we have a do high suspicion that he has that, but for the confirmation, we are going to wait for the results. And for the starting of the treatment, we are going to wait for the results, right? So it depends on the scenario that what words are being used and what exactly is written in the task, that what do you have, because there have been a scenario in the past in which the child had bicytopenia in the labs and they did not use the word of leukemia. They just said that you have to tell the test results. So in that you did not like in the you just had to tell in those scenario, in that scenario you had to tell the parent that the child is having the decrease in the blood cells and the white and the red blood cells. It can be due to some infection, it can be due to certain malignancy, and we are going to do further testing for that, right? So it really depends on the scenario and the task. Okay, so do we have any more questions here or any remarks? If would you like to say that how did you find today's session? Was it helpful? Did you get to learn something from today? Would be really helpful for all of us. Your feedback is really important, and so that we can have further sessions like this in future.
Madam, I think we should. I think we are expecting some scenarios which are common diseases made by you, and we can read it online, or we can do a practice. Maybe you have some scenarios, regarding certain diseases, which are usually come across in a clinical examination. So, if you would like to share these scenarios.
Okay, I think for the communication, usually the common scenarios are about the recalls. So whenever you're preparing for the clinicals, the most important resources that you can go through are the recalls. So just keep an eye on all the recalls that have been shared, go through them, and yes, we can have the common scenarios compiled, and maybe we can share them in the group as well. Thank you for your suggestion. Thank you. Okay, thank you so much, everyone who logged in and who responded, and thank you, Dr. Imran, who like you participated. Okay, I think yeah, there's a question in cases when parents ask regarding the chances of the next child being affected, but we don't know the exact percentage. For example, syndromes, how do we manage this? Okay, so you can refer to the gene doctor for this. Like if there's a Down syndrome and you do not know, for that you see you have to tell that we have to do certain tests, and like for the syndromes, obviously there's genetic conditions. You have to get the gene testing ruled out, and for that you have to refer the child to the gene doctor. So you see that you can generally say that yes, if there's a child in a family of certain disease, there can be a increased risk in the next pregnancy. But for that, I can refer you to the gene doctor, and he can guide you about this further on. Right? So thank you so much everyone for joining in. I am really thankful to all of you for spending this time and logging in here and giving us all of this feedback. Uh, do keep on like we. I just want to mention one other thing. If you are in the clinical session practice group, I do post tasks there, and I definitely look into that, and I do comment. So if you have any, if you want to practice, then do respond in those groups as well, so that you can learn, and just keep dropping in your suggestions for the next sessions as well, and hopefully we'll have another section in the next 1 or 2 weeks. So thank you so much everyone. Have a very good night and a very good weekend. See you next time. Bye bye everyone.